There is something deeply frustrating about doing everything right and still feeling wrong. You read the label, you took the supplement, you followed the advice, and yet the fatigue is still there. The brain fog still rolls in by mid-morning. Your hands still feel strange, either numb or tingling in ways that were not happening 10 years ago. You went to your doctor, had your blood drawn, and the results came back showing your vitamin B12 levels are completely normal. So why do you still feel this way? The answer has nothing to do with whether you are taking B12. It has everything to do with how you are taking it, what form you're using, and what is quietly happening inside your body after the age of 60 that changes everything about how this vitamin works. Vitamin B12 is not optional for your body. It is not a bonus nutrient that helps a little here and there. It is fundamental to some of the most important processes keeping you alive and functional every single day. Your nervous system depends on it. Every single nerve in your body is wrapped in a protective coating called myelin, and without adequate B12, that coating begins to deteriorate. When myelin breaks down, nerve signals become slow, distorted, or blocked entirely. That is when you start feeling the numbness, the tingling, the strange sensations in your feet when you walk, or in your fingers when you type. These are not random inconveniences. These are your nerves sending distress signals. Your brain is equally dependent on B12. Brain cell communication, memory formation, cognitive clarity, the ability to focus and process information, all of these require B12 to function properly. When your brain cells do not have enough usable B12, thinking becomes harder. Words feel farther away. You walk into a room and forget why you went there. You read a paragraph and have to read it again because nothing stuck. Many people accept this as an inevitable part of aging, but it is not inevitable. It is often a sign of a specific, correctable deficiency that has gone unaddressed because the real problem was never properly identified. Your red blood cells also need B12 to form correctly. When B12 is insufficient, red blood cells can become abnormally large and misshapen. They do not carry oxygen as efficiently as healthy cells do. Less oxygen reaching your muscles and organs means fatigue that feels heavy and persistent, not the kind that goes away after a good night's sleep. It is the kind that sits with you from the moment you wake up. Your legs feel heavy. Your motivation is low. Everything feels like more effort than it should. And meanwhile, your blood test says your B12 is normal. This is where the real story begins. Understanding why those blood tests can be misleading requires understanding what they actually measure. A standard B12 blood test measures the total amount of B12 circulating in your bloodstream. It counts everything that is floating around in your blood. But having B12 in your blood is not the same as having B12 inside your cells, where it actually does its work. You can have what appears to be a perfectly normal blood level of B12, while your nerve cells, your brain cells, and your red blood cell production are all starving for usable B12. The blood test gives your doctor a number, but that number does not tell you whether the B12 is actually getting into the tissues that need it. And after the age of 60, that gap between blood levels and cellular availability becomes a very serious problem for many people. The reason this gap exists, the reason older adults absorb and use B12 so differently than younger people, comes down to a dramatic change in digestive function that happens with age. Your stomach produces acid. That acid serves many purposes, but one of its most critical jobs is to separate B12 from the food or supplement it came in with. When you eat meat or take a tablet, the B12 is bound to proteins. Stomach acid breaks those bonds and frees the B12 so it can then attach to a specific carrier, protein produced in your stomach lining, called intrinsic factor. Intrinsic factor escorts B12 through your small intestine and allows it to be absorbed into your bloodstream. Without adequate stomach acid and adequate intrinsic factor, this entire process fails. The B12 travels through your digestive system and exits your body without ever being absorbed. Here is the difficult truth about aging and stomach acid. After the age of 60, stomach acid production declines significantly. Research suggests that more than half of all older adults have meaningfully reduced stomach acid. This condition often goes completely unnoticed because it does not always cause obvious digestive symptoms. You may feel perfectly fine after eating, you may have no heartburn, no bloating, no discomfort, and yet your stomach is producing far less acid than it did when you were younger. And that quiet change is quietly robbing you of your ability to absorb B12 from your food and from standard supplements. At the same time that stomach acid is declining, the production of intrinsic factor is also decreasing. Both systems that are needed to absorb B12 through the normal digestive route are weakening simultaneously. This means that a 65-year-old person taking the same B12 tablet they have taken for years may now be absorbing only a fraction of what they absorbed when they were 45. The tablet has not changed. The dose has not changed. But the body receiving that tablet has changed in ways that make the entire absorption process dramatically less efficient. Now let us talk about the specific mistakes that are preventing many older adults from actually getting the B12 benefit they think they are getting. These are not obscure or complicated errors. They are common, understandable mistakes that millions of people make every day simply because no one explained to them how profoundly the rules of B12 absorption change after 60. The first mistake is taking a standard B12 tablet swallowed with water. This is how most people take their supplements. You pop the tablet in your mouth, swallow it with a sip of water, and assume that your body will handle the rest. For a younger person with robust stomach acid and healthy intrinsic factor production, this approach works reasonably well. But for an older adult whose stomach acid is depleted and whose intrinsic factor production has declined, a standard swallowed tablet is almost useless. The tablet arrives in a stomach that cannot properly process it. The B12 never gets freed from the tablet effectively. It never binds properly to the intrinsic factor that would carry it into absorption. A significant portion of what you swallowed simply moves through your system and is eliminated. You paid for it. You took it faithfully. But your body never received the benefit. The second mistake is using the wrong form of B12. This is perhaps the most widespread and least discussed problem of all. If you look at the ingredient label of most standard B12 supplements sold at pharmacies and grocery stores, you will see a word that most people skip right over: cyanocobalamin. Cyanocobalamin is a synthetic form of B12. It is cheaper to produce, it is more stable on a shelf, and it is used in the majority of affordable supplements. But cyanocobalamin is not the form your body actually uses. Before your cells can do anything with it, your body must first convert it into an active form. That conversion process requires a healthy liver, specific enzymes working properly, and strong antioxidant systems all functioning together. In a young, healthy body, this conversion happens without much difficulty. But after 60, all of those systems slow down. Liver function is not what it was at 30. Enzyme activity is reduced. Antioxidant reserves are lower. The conversion from cyanocobalamin to active B12 becomes sluggish and incomplete. You may be taking 1,000 micrograms of cyanocobalamin every day, and your body may only be converting a small portion of that into the form it can actually use. This is one of the main reasons people with apparently normal blood levels still feel the symptoms of B12 deficiency. The blood test is picking up unconverted or poorly utilized B12, but the cells are not receiving the active form they need. The active forms of B12 that bypass this conversion problem entirely are methylcobalamin and adenosylcobalamin. These are the forms your body actually uses directly. When you take methylcobalamin, your cells do not need to convert it. It is already in the form that can go straight to work supporting nerve repair, brain cell function, and red blood cell production. Adenosylcobalamin works specifically within your mitochondria, the energy-producing structures inside your cells, and supports a different but equally important set of metabolic functions. Together, these two active forms cover the full range of what your body needs B12 to do. Switching from cyanocobalamin to methylcobalamin alone can produce noticeable improvements in energy and clarity within weeks, simply because the body is finally receiving B12 in a form it can actually use. The third mistake is taking B12 inconsistently. This is extremely common among older adults who treat B12 the way they might treat a pain reliever. You feel tired, so you take it. You feel better, so you stop. You forget for a few days and figure it does not matter much. But B12 does not work like a pain reliever. It does not give you a quick boost of energy the way caffeine does. It is a slow, steady repair nutrient. Its primary job is to support the ongoing rebuilding of myelin, the protective sheath around your nerves, and to maintain the metabolic processes that keep your nerve cells and brain cells functioning properly. Myelin repair is not an instant process. It happens gradually over weeks and months of steady, consistent B12 availability. Every time you skip a day, every time you go several days without your supplement, you interrupt that repair process. The nerve rebuilding that had been quietly progressing is paused. And when you restart, you are not picking up exactly where you left off. You are working against the disruption that the gap created. People who take B12 consistently every single day, without exception, see dramatically better results than people who take the same total amount of B12 but spread it inconsistently. Daily consistency is not a preference. For nerve repair, it is a requirement. The fourth mistake is taking B12 at the wrong time of day. This surprises many people because they have never been told that timing matters with B12. But it genuinely does. B12 is involved in cellular energy production and nervous system activation. It supports the metabolic processes that generate energy at the cellular level. For some people, particularly those who are sensitive to B12's activating effects, taking it in the evening or before bed can interfere with sleep. It can create a subtle state of increased alertness that makes it harder to fall asleep or stay asleep through the night. This matters enormously for older adults because poor sleep is already one of the most serious health challenges in this age group, and poor sleep creates a cascade of problems that directly undermines the very benefits you are trying to get from B12. Inadequate sleep increases inflammation throughout the body, including in nerve tissue. It elevates stress hormones that interfere with cellular repair. It slows the very recovery processes that B12 is trying to support. Taking B12 late at night and then sleeping poorly is essentially working against yourself. The solution is simple. Take your B12 in the morning or early afternoon. This aligns the supplement with the times of day when your body is most metabolically active and avoids any potential interference with your sleep. The fifth mistake is underestimating the role of hydration. This one is so simple that many people dismiss it entirely, but hydration is genuinely important for how effectively nutrients move into your cells and tissues. Your cells are surrounded by fluid. Nutrients travel through fluid to reach cell membranes. Once inside, they move through fluid-based environments within the cell itself. When you are mildly dehydrated, this entire transport system slows down. The delivery of B12 to nerve tissue, to brain cells, to the places where it is needed becomes less efficient. Mild dehydration is extremely common among adults over 60, partly because the sensation of thirst becomes less reliable with age. You may not feel thirsty, but your cells may still be working with less fluid than they need. Drinking adequate water throughout the day, not in large amounts all at once, but consistently through the day, supports everything your body is trying to do with the nutrients you are giving it. There is another layer to this conversation that many people are never told about, and it involves the medications that millions of older adults take every day. Certain very commonly prescribed medications significantly reduce B12 absorption, and many people have been on these medications for years without anyone explaining the nutritional impact. Acid-reducing medications, including proton pump inhibitors and H2 blockers, work by decreasing stomach acid production. They are prescribed for acid reflux, heartburn, and stomach ulcers. But stomach acid, as we discussed earlier, is essential for freeing B12 from food and supplements. Reducing stomach acid further compounds the absorption problem that aging has already created. Metformin, one of the most widely prescribed diabetes medications in the world, has been shown in multiple studies to reduce B12 absorption through a mechanism involving calcium-dependent processes in the intestine. Long-term metformin use is associated with a measurable decline in B12 levels over time. Certain antibiotics also disrupt the gut environment in ways that affect B12 absorption and utilization. None of this means you should stop taking your medications. That is a decision that belongs to your doctor, never to a supplement protocol. But it does mean that if you are on any of these medications, your B12 support needs to be more deliberate, more carefully chosen in terms of form and delivery method, and more consistently maintained to compensate for the added absorption challenge. This brings us to the most important practical question, which is what the correct approach actually looks like for an adult over 60 who is serious about getting real benefit from B12. The first and most critical shift is choosing the right form. Look for methylcobalamin, or a combination of methylcobalamin and adenosylcobalamin. These are the active forms. They are available at most health food stores and increasingly at mainstream pharmacies. Read the label carefully. If the supplement lists cyanocobalamin as the primary form, set it aside and find one that uses the active forms instead. This single change makes more difference than almost anything else in this protocol. The second shift is choosing the right delivery method. Sublingual B12, meaning B12 that dissolves under your tongue, bypasses the entire stomach acid and intrinsic factor problem. The mucous membranes under your tongue are rich with tiny blood vessels, and nutrients placed there are absorbed directly into the bloodstream, without needing to pass through your digestive system at all. Sublingual B12 tablets or liquid drops held under the tongue for 1 to 2 minutes before swallowing allow direct absorption that is not dependent on how much stomach acid you produce or how well your intrinsic factor is working. For older adults with reduced digestive absorption, this delivery method can make the difference between getting meaningful benefit and getting almost none. The appropriate daily dose for adults over 60 looking for genuine nerve and brain support falls in the range of 1,000 to 2,000 micrograms per day. This sounds like a large amount compared to some supplements, but B12 is water-soluble. Your body takes what it needs and excretes the rest through urine. There is no meaningful risk of toxicity from taking B12 in this range. The higher dose is recommended specifically because absorption is imperfect, even with the best delivery methods, and ensuring that enough B12 is available compensates for whatever absorption losses still occur. B12 also does not work entirely alone. It functions within a network of nutrients, and two of its most important partners are folate and vitamin B6. Folate, particularly in its active form called methylfolate, works alongside B12 in the cellular processes that support nerve function and brain health. When folate is insufficient, B12 cannot do its job fully, even when it is present in adequate amounts. Similarly, vitamin B6 participates in nerve metabolism and supports the enzymatic processes that B12 depends on. Ensuring that your diet or supplement routine includes these two nutrients alongside B12 creates a far more complete and effective foundation for nerve and brain support. One of the most important mindset shifts for measuring whether this protocol is working is to stop looking primarily at your blood test results as the measure of success and start paying attention to your symptoms instead. Blood tests have their place, but as we established earlier, they do not capture the whole picture of how well B12 is being used at the cellular level. The true measure of whether you are getting enough usable B12 is what you feel. Are the tingling or numb sensations in your hands and feet reducing over time? Is your balance improving? Is your thinking clearer? Do you feel more mentally present during conversations? Is your energy more stable through the day? These symptom changes are the real signal that your nerves and brain are receiving the B12 they need. The timeline for improvement requires patience and it requires honesty about expectations. Some changes, particularly in energy and mental clarity, can appear within the first 2 to 4 weeks of switching to the correct form and delivery method. These early improvements reflect better cellular energy production and improved brain cell communication. But the deeper changes, the reduction in nerve tingling and numbness, better balance and coordination, and the rebuilding of myelin around damaged nerve fibers, these take longer. Nerve tissue heals slowly. Meaningful improvement in nerve symptoms typically requires 60 to 90 days of consistent daily use before significant changes become apparent. Some people with longer-standing nerve damage may need even more time. This is not a reason for discouragement. It is simply the reality of how nerve healing works, and it is exactly why consistency matters so much. There are also situations where B12 alone is not enough to resolve nerve symptoms, and it is important to be honest about this. Some conditions cause nerve damage through mechanisms that B12 cannot reverse on its own. Diabetic peripheral neuropathy involves damage from prolonged blood sugar disruption that requires comprehensive management beyond supplementation. Nerve compression from spinal problems, carpal tunnel syndrome, or cervical spine changes produces symptoms that overlap significantly with B12 deficiency symptoms, but require different interventions entirely. If you have been consistent with the correct form, correct delivery method, adequate dosing, and daily use for 90 days and are still experiencing significant symptoms, that is the moment to return to your doctor with specific questions. Ask about nerve conduction studies. Ask about whether underlying conditions need to be addressed. Use the B12 protocol as your foundation, but do not allow it to delay proper medical evaluation if symptoms persist. The broader context of nerve health also matters. B12 is one powerful piece of a larger picture. Blood sugar control is enormously important because high blood sugar is one of the most damaging forces to nerve tissue in the human body. Chronic inflammation, whether from diet, stress, poor sleep, or other sources, creates an environment that slows nerve repair and undermines everything B12 is trying to accomplish. Sleep quality affects the rate of cellular repair throughout your entire body, including your nervous system. Physical activity, even gentle walking, supports circulation to the extremities and helps deliver nutrients including B12 to the nerves in your feet and hands. Managing stress through whatever practices work for you reduces the cortisol and inflammatory signals that interfere with cellular healing. All of these factors are the environment inside which B12 does its work. Improve the environment and B12 becomes more effective. You have spent 60 or more years building a life, maintaining relationships, carrying responsibilities, and contributing to the world around you. Your nerves, your brain, your energy, all of these are not luxuries. They are the infrastructure that allows you to keep doing what matters to you. The clarity to think through a problem, the energy to play with grandchildren, the steady hands and reliable balance that let you move through your days with confidence. You deserve to protect those things with every tool available to you. And now you have a clearer picture of exactly how to do that with one of the most essential nutrients your body depends on. The changes required are not complicated. They are specific, they are manageable, and for most people, they make a real and noticeable difference in how their body feels and functions every single day.